I'm Dr. Neeta Chavan. Today we are going to discuss about vegetable poison, so that is the castor seeds. So these are the seeds. You can see the plant, it is a totally green. Their seeds, the capsules. The castor seeds, they are smooth, flattened oval with light and dark brown markings. They are bright and polished. They are of two sizes, small and big. The main active principle, that is the entire plant, is actually it is a poisonous. It contains the toxalbumin ricin, which is a water soluble glycoprotein, and it is a powerful allergen. Mainly the seeds contains the highest levels of a ricin, which is highly toxic and can be in the form of a powder, mist or pellet. It can be dissolved in a water or a weak acid. Ricin founds up to 3 to 5% of the waste material, so that is also known as a white mash, that is leftover from the processing castor bean into a castor oil, which is used as a purgative oil. Actually, the castor oil is not poisonous. Then it is from the castor oil and from the leftover, that is the white mash, it can be separated by chromatography. Ricin is antigenic in nature. It agglutinates the red cells. It causes the hemolysis and cell destruction. The main action, that ricin blocks the protein synthesis through the inhibition of RNA polymers. It belongs to the group of poisons known as AB toxins. Ricin has a specific binding protein that gains the access to the endoplasmic reticulum of the gastrointestinal tract mucosal cells, which causes diarrhea. The signs and symptoms what it produces, so mainly, so that is by inhalation, by ingestion and by local application, that is by injection. So first we will see if it is inhaled. So by inhalation it is more potent than the oral ingestion. Dust of the seeds may cause watering of the eyes, conjunctivitis, acute nasal inflammation with a sneezings. Then afterwards it produces headache, pharyngitis, even asthmatic bronchitis. It also produces gastric upset, dermatitis. Inhalation causes non-cardiogenic pulmonary edema. That means it gives rise to, because of the inflammation of the respiratory tract, it also gives rise to the pulmonary edema, which is not related to any cardiac pathology. Diffuse necrotizing pneumonia, then interstitial and alveolar inflammation and edema. When it is ingested, that means when it is taken by the mouth, so usually the symptoms can be seen within 10 hours of ingestion. So the symptoms which produced, they are on a GIT, so that is on a gastrointestinal tract, as burning pain in a throat, then colicky abdominal pain, cramps, along with there is a nausea, vomiting, thirst is increased with a bloody diarrhea. So because of that bloody diarrhea, it may leads to hypovolemic shock by volume depletion, and even afterwards the renal failure may occur. The action on a CNS, that is on a central nervous system, it causes vertigo, drowsiness, delirium, convulsions and coma, uremia and rapid feeble pulse, cold clammy skin and dehydration. These are the main symptoms which are marked when the ricin or the castor seeds are taken orally. The local injection, when it is applied to the skin, that is the ricin toxalbumin, or if it is injected, it produces erythematous rash, induration, blisters, localized necrosis at the site of the injection, swelling of the regional lymph nodes. These symptoms progress and it produces seizures, hypertension, shock, even the other organ failures along with the pulmonary edema, and which is leading to the respiratory failure. Main thing is that the person's consciousness remains till the death in some cases. The castor seeds, mainly the fatal dose, so usually it is 10 microgram per kg body weight when it is inhaled or injected. Exposure to the ricin is is a less toxic, and the lethal dose about 20 microgram per kg, that is 10 to 20 seeds, so that is when it is oral exposure. Fatal period usually within 3 to 5 days. For the treatment, mainly there is no specific antidote or treatment, although the vaccine has been developed by US military. The main thing which we can do to take care of if the dust is the person getting exposed to the dust either by inhalation. So firstly, he after suspected ricin inhalation or the exposure to powdered resin, remove the clothes and wash the skin with water. In case of ingestion, do the gastric lavage, emetics and demulcent can be given. Intravenous glucose saline for the dehydration should be given. Then 2 to 5 grams of sodium bicarbonate 8 hourly by mouth to alkaline the urine, and if required, the blood transfusion should be given. Then we will see the post-mortem findings if the death occurs. So the death is caused by ingestion of castor plant seeds. It is very rare because of its indigestible capsule. Then if it is broken seeds are ingested, then the mucosa of JIT can be congested, softened, inflamed with erosions and submucous hemorrhages. Fragments of seeds may be found in the stomach and intestine. Dilatation of heart, hemorrhages in the pleura, edema, and congestion of other organs like liver, kidneys, brain and lungs are found. Then what will the medico-legal aspects of the ricin poisoning or the castor oil poison? Accidental poisoning may occur in children through the ingestion of castor beans. Rarely the powder seeds are given for homicides. Ricin can be used as an agent of a biological warfare for or a weapon of mass destruction. The powder seeds causes conjunctivitis when applied to the eyes. So that is all about the ricin or the castor seeds. Thank you.